Hi everyone, I am Meja Mashatula, Industrial and Organizational Psychologist. I hope you are all well. So, welcome to this session. We'll be clarifying the role of industrial and organizational psychologists in the management of substance use in the workplace. So the aim of this presentation is to clarify the critical role of industrial and organizational psychologists in the prevention, early identification, intervention, and organizational management of substance use in the workplace. The specific focus is on enhancing employee well-being, safety, productivity, and legal compliance within the South African and high-risk environments such as the military and other security-related clusters. What I will cover in terms of this presentation is the introduction, understanding workplace substance use, relevant legislative policy frameworks within the South African context, the role of industrial and organizational psychologists, the best practices for industrial and organizational psychologists, and concluding remarks. Workplace substance use and abuse, they pose a serious risk to safety, productivity, and organizational effectiveness. So we all know that in a high-risk sector such as the military, aviation, security, and transport, even minor impairment as a result of substance use can result in catastrophic outcomes. So that's the reason I'm presenting to you today, to get to understand what would be your role in situations where there is a tendency to use substance within the working environment. So the industrial and organizational psychologists contribute significantly through the prevention, early identification, intervention, and organizational level system. So that is more of a proactive stance. So, but before we get into this, because now we know the topic is workplace substance use. Before we get to talk more about it, it's important to clarify the distinction between substance use and substance abuse, because oftentimes people confuse the two. Oftentimes there's misconceptions and controversies around how do I know if it's abuse, how do I know if it's misuse. So I'll clarify that just now. So when you talk about substance use, it's a voluntary consumption of psychoactive substances that may or may not impair functioning. That is, you're using it voluntarily, so it's not prescribed, it's not anything. It might be prescribed in terms of some of the medications that have alcohol that may also influence your decision making. However, some of the people we know under certain circumstances, they tend to misuse that. So the moment you use it beyond the legal prescription, it becomes substance use. But what is this substance abuse? Substance abuse is a maladaptive pattern of use causing impairment in health, in your physical health, in safety, or role functioning. It can include alcohol, opioids, stimulants, prescription, misuse, nyaope, and some of the substances that are not listed here. So the moment you overuse it, the moment you become codependent on it, that fits the description of what you call misuse or abuse. I hope this distinction help in this regard. So, but the question now becomes, why does it matter? Why understanding workplace substance use matters? Why does it matter in organization? Let's look at that. It matters because workplace substance abuse contributes to cognitive and safety impairments, can also affect interpersonal conflicts or workplace relationships result in conflicts, and lowered productivity, high absenteeism and presenteeism situations where employee report to work, but in terms of output, you can't really say much. Increased healthcare cost as well as organizational liability. So that's the reason why we're talking about this today and why we've got to clarify the critical role of IOPs. So within the South African context, we know in terms as much as mental health is concerned, that South Africa has one of the highest alcohol consumption rates in Africa. And we are going to be looking at that just now. Dare to say, South Africa has been ranked one of the highest alcohol consumption rates rated in Africa. And we know the most significant one is cannabis, IOPs, and we also know that military and uniform environments show increased vulnerability due to occupational stress, trauma exposure, and cultural effect. We know military is quite inherently stressful and demanding environment. So some people who struggle to cope under pressure, they tend to resort to these substances. It starts with a small amount of it until before you know it is too much. It's overdoses because it helps them to cope and stuff like that. So, but should we be using substances within the working environment? I think what is important and what can also guide us in terms of this, it's what is the legal stance, what is the legal position within the South African context as far as the legislative framework is concerned with regard to the use of substance within the working environment. So we are now going to be looking at the on relevant legislative frameworks as well as the policies. So in terms of the legislative requirements, according to Occupational Health and Safety Act 85 of 1993, an employer has duty to ensure a safe workplace which prohibits intoxication at work. That is, for as long as you enter the premises of the employer. An employer has an obligation to ensure that the workplace is safe. That is, to regulate the conduct of employees, to regulate the use of substance within the working environment. Because the moment you are intoxicated, you're under the influence, your mental faculties are temporarily impaired, and that can compromise safety, security, as well as other critical issues. So let's move to Labor Relation Act 66 of 1995. So which distinguishes misconduct versus incapacity, addiction considered treatable. So in terms of this, we're looking at the moment one is under the influence and reports to work, an employer is obliged also can actually give you a warning, can actually summarily dismiss you on the basis of you engaging in gross misconduct as a result of the use of substance, because as I indicated earlier, it can impair your mental faculties. Also, if it gets to a point of codependency, incapacity, that is inability for you to do your job, if you're occupying a very critical role, how impaired are you? So if the employer feels like you are impaired, or objectively you are impaired to execute your duties, that can also be a ground for summarily dismissal. That is basically to say, if you are occupying a post where you're dealing with critical information, critical stuff, where you need to be in a sober state of mind, if you do something that compromises that, an employer can take an action. So the other thing is Employee Equity Act 55 of 1998, which prohibits unfair discrimination and support reasonable accommodation. So this one now strikes a balance to say, but how do we support and come forth for those individuals who are having challenges? So individuals who are having problems such as addiction, employees that have been referred for rehabilitation, on those who are struggling with substance use. In situations like that, an employer is prohibited for unfairly dismissing or automatically dismissing them on the basis of that. But the employer is obligated to provide reasonable accommodation, that is, to support the employee to go through the process of rehabilitation and ensure that they are accommodated within the working environment. That can also mean modification of the task that they are doing. If they were in a critical post, transferring them to a lesser critical post until they've recovered and they are reinstituted up and readjusted back into the previous role. So we also have the SNDF and DOD policies that are zero tolerance in operations in terms of substance use, but they also support the well-being of employees in terms of rehabilitations. That is to say, there is a zero tolerance in terms of substance use and misuse within operations, because they compromise the integrity of the organization, the integrity of data that you've got to deal with, and the security. So in situations like that, your employer, there was a controversy around the use of marijuana or whatsoever within private space. But the question we spoke about so many times is, what constitutes private space? If you are living in the military base, you are a living-in member, and you say it's your private space, whereas other people are coming in the unit every morning to work. So we had interesting discussions around that when someone says, but it's my private space, and we looked at that to say, so if it's a private space, someone can just go during tea time and smoke or drink and so things like that and come back. But the thing is, you do all those things in your private space, but the moment your behavior affects those of other people, then it becomes a concern. The moment whatever that you're doing in private manifests in public, it becomes a concern. So we're dealing with what? The conduct. Behavior is overt, so it's external. Right. So the last one is Basic Condition of Employment Act 75 from 1997, which regulates working conditions affecting safety. So in terms of this one, the substance use within the working environment is prohibited on the basis of compromising the safety and welfare of other employees, including that of the person using substance. However, provision is made to those who are having addiction, because it's viewed and recognized as a treatable health condition. So in terms of that, again, it goes to the third one, which says the employee needs to effect reasonable accommodation. Right. I hope we understand this part. I know I'm rushing because we don't have too much time in terms of this, but you're more than welcome to post questions, to ask questions. But next thing is, with the knowledge that we've got, the insight we've gathered so far, what could be the role of industrial and organizational psychologist, which forms the critical aspect or the crux of this presentation? So IOPs contributes across a continuum. So like I alluded to earlier, IOPs get to be involved in terms of prevention, early identification, that's the prevention, policy development, psychosocial risk assessment, awareness and psychoeducation. Then we've got the early identification, intervention, multidisciplinary collaboration, where they're working with other people, professionals, and return to work support, reintegration. So in terms of prevention, we're looking at the policy development. So the developing policies or reviewing policies to focus on fitness for duty frameworks for the employees, drug and alcohol policies to help an employer effect those, and as well as getting involved with the wellness and employee assistance programs. So EAP is just for employee assistance programs. And then when it comes to psychosocial risk assessments, the IOP's role is to identify organizational risk factors for substance use or abuse through evidence-based assessment. So here it's important that one gets to understand and have a thorough understanding of those evidence-based assessment. So it's several assessments, safety audits, analysis of absenteeism trends, climate surveys, stuff like that. There are a lot, but it depends on what is the purpose for that. And the other aspect is that one of contribute to awareness and psychoeducation in terms of providing training on health effects of substance, stress and coping, help-seeking behavior, and stigma reduction. That is the first phase of it. The second phase of it is early identifications, where IOPs implement this evidence-based screening and behavioral observation. So here the focus is on work performance indicators. The focus again more here is on the behavioral red flags. Employee changes in terms of mood, frequent lateness, performance declining, that is productivity, loss of productivity, safety violation, withdrawal symptoms, increased conflicts. That is where the early identification focuses on. So that is the second phase of it. The third phase of it within the IOP scope and limitation is intervention. So we are going to look at interventions, which involves case management, where IOPs coordinate multidisciplinary interventions. That is basically in terms of referrals to social workers, clinical psychologists, psychiatrists, monitoring of treatment compliance, facilitation of communication with supervisors, as well as providing workplace counseling. So we provide that, and then you refer for clinical addiction and treatment according to the referral pathway or protocol. And then there are other things there in terms of counseling. It depends on the purpose. You can do stress management also, behavioral contracting, but what is key is to know when to refer for clinical addiction treatment. And then the last one is workplace accommodation. So here IOPs work in conjunction with a human resource officer or occupational health and safety representative. So in terms of modifying the duties of an employee who's busy with the employee assistance program, temporarily removal from safety sensitive tasks, that is adjusted shift, those that constitute the one I indicated earlier, reasonable accommodation, and to also help in terms of designing structured return to work support plans. So the other one that is quite also important is IOP work closely with other professionals. We call it multidisciplinary collaboration. So you work closely with others such as social workers, primary addiction therapists in military, occupational health practitioners, chaplains, medical officers, commanders, or supervisors. So this is to balance employee well-being and operational readiness. So you don't do all these things in vacuum. You work with others because they are also interested and ethically obliged to look after to support the well-being of the employee. So as soon as this have taken place, now we've got to look at the other element which is also important, and that is return to work support. So IOPs manage structured return to work protocols, that is including fitness for duty assessment, the gradual reintroduction into the former role, performance monitoring, is there significant improvement or relapses, and relapse prevention planning. So that is Now, the whole process in terms of IOPs, involvement, their critical role in terms of this. However, everything that I've mentioned, everything that I've said needs to still reflect the best practices for every professional. For IOPs, the following will constitute best practices: promoting a non-punitive, health-focused model within the organization to integrate mental health and substance use strategies, to conduct early screening and systematic monitoring, to strengthen supervisor training. This is important because supervisors are the ones that spend a lot of time with those employees, and to reinforce confidentiality within health HPCSA boundaries. We know about that. And implement evidence-based interventions such as motivational interviewing, brief interventions. So everything that you do will need to be backed up by research. It needs to be thoroughly researched. It needs to, whichever assessment that you choose needs to have good psychometric properties and must have been standardized already. So the use of data-driven organizational strategies also is important. Reduce of stigma, encourage help seeking. This is a sensitive issue. Not everyone chose to be in that situation, so you need to also help to reduce stigma so that members can come forth and seek professional help. And you provide structured return to work and follow-ups. Also work with HR and occupational safety to design or to develop a protocol for return to work and follow-up, and also collaborating with multidisciplinary teams. So check with those people that you refer to check how is the employee doing, whether they need support or not. Right. That's the crux of the matter. And the other things, you are more than welcome to ask questions. So there will be a follow-up presentation touching more in depth in terms of this. So, but for now, I just wanted to critically clarify the roles of IOPs. Right. In essence, we can say IOPs are uniquely positioned to manage workplace substance use. They integrate psychological expertise with organizational strategy, thereby enhancing safety, productivity, and well-being, especially in a high-risk context such as security cluster. Right. So we align our psychological expertise with organizational strategies to ensure organizational success as well as employee well-being. Right. I hope you are able to grasp what this presentation intends to equip you with, and for any question, you're more than welcome to post, to ask, and to reach out to me in terms of your emails, and I will respond. So substance use is not just a workplace problem. People tend to make it a personal thing. It's being human. It's being a human, and your role there is to help the organization listen, sensitize them how to respond and how to heal from that. Because they also have hope, they also have trust and believe that this is the right employee fit for the position or fit for the role. But at some stage, when employee is overwhelmed and cannot cope, they resort to substance and disappoint themselves and the organization subsequently. So my take on terms of this is, as professionals, irrespective of your scope of practice, where psychology meets the workplace, safety becomes a culture, because you help them to look at things in different perspectives, to design interventions and implement and evaluate for effectiveness and monitor. So where psychology meets the workplace, safety becomes culture and well-being becomes a strategy, because with human capital you will be able to attain organizational success. Right. Thank you so much for your time and for your attention, and I hope and believe that this is well received and has shed light in terms of your understanding of the topic and your role out there. Let's also reflect on our training and our knowledge and our interest, and come up with areas that we feel like needs to be explored more, and to help others who are also keen in learning like you. Thank you so much for your time. You've been great audience, and thank you for your precious time. Thank you. Bye bye.